Good evening everyone. This is KAVIPRIYA, lecturer from SNS College of Allied Health Science, Department of Cardiac Technology. Today we are going to see about the lecturer topic is about electrocardiogram ECG systems. So here a lead provider views of heart electrical activity between one positive pole and another negative pole. That is between two poles lies an imaginary line representing the lead's axis, and a term refers to direction of current moving through the heart. So the direction of current affects the direction in which waveform point on the ECG. So when there is no electrical activity, it's too weak to measure, the waveform looks like straight line. It is also called as isoelectric waveform. Here we having two leads, direct and indirect leads. Among that, indirect leads consist of chest leads, limb leads, esophageal leads. In limb leads, bipolar and unipolar leads are there. That is in a frontal plane. So bipolar leads are called as lead 1, lead 2, lead 3. It is lead 1 is placed between the right arm negative terminal and left arm positive terminal. Lead 2 is between the right arm negative terminal and left arm positive terminal. And lead 3 placed between the left arm negative terminal and left leg positive terminal. This is an Einthoven triangle. The right arm is consists of lead 1 is placed between right arm and left arm. Right arm is negative terminal and left arm is positive terminal. Lead 2 is placed between the right arm and left leg, negative and positive terminal. Lead 3 is placed between the left arm and left leg, positive terminal. This is Einthoven triangle. And what is Einthoven law? If electrical potential of 2 of 3 bipolar limb electrocardiographic leads are known at any given instant, that is third one can be determined. Positive and negative signs of different leads must be observed. So according to Kirchhoff's law, lead 1 and lead 2, lead 3 is equal to 0. For Einthoven law, lead 1 plus lead 3 is equal to lead 2. Another one can be defined. So unipolar limb leads are there. AVR, augmental limb leads. Unipolar chest leads. Here AVR, AVL, AVF are there. That is called as augmental limb leads. AVR is connected between right arm. That is indifferent electrodes are left arm and left leg. And AVL is connected in left arm, indifferent electrodes are right arm and left leg. And AVF is finally connected here, indifferent electrodes are right arm and left arm. This is augmental limb lead connections. And unipolar chest leads. Unipolar chest leads are line transverse plane or horizontal plane, and V1, V2, V3, V4, V5, V6 are called as unipolar chest leads. Lead 1, lead 2, lead 3 is placed on, it is also called as unipolar limb leads. Here V1, V2, V3, V4, V5 and V6 is called as unipolar chest leads. Here V1 is placed in 4th intercostal space to the right of sternum. V2 is placed between the 4th intercostal space left of the sternum, and V3 is placed in between V2 and V4, and V5 is placed in mid-clavicular line of 5th intercostal space, and V5 is placed between the V4 and V6. So finally V6 placed between the 5th intercostal space of mid-axillary line, and special leads are also there, V7, V8, V9, and also esophageal leads are there, VE 15 to 25 record the activity of right atrium, E25 to 35 record the activity of AV groove, and 40 to 50 is posterior surface of LV. And now we gonna see about normal electrocardiogram. See, this is the block diagram of normal ECG. See, there is P wave, Q, RS complex, T and U waves are there. This is normal ECG. It consists of P wave. This is positive, first positive deflection represent the atrial depolarization. Normal duration is 0.08 to 0.12 second. Amplitude is about 0.1 to 0.3 millivolt, and it is less heightened dome shaped. QRS complex, it consists of 3 waves, Q, R and S. It represents ventricular depolarization. Normal duration is about 0.08 to 0.12 second. Amplitude is about 0.7 to 4 millivolt. And Q wave, initially negative deflection, represents septal depolarization, small downward shock wave absent in all the right ventricular leads and present in all bipolar leads. R wave, it is positive deflection QRS complex due to potential traveling through the apex of ventricle. It is an upward bigger sharp wave, and peak of R wave is safest period as ventricle in absolute refractory period. S wave, it is a second negative deflection in QRS complex. It is due to potential traveling to the base of ventricle. It is small negative sharp wave. And T wave, it is a positive wave following S wave and represent ventricular repolarization, and it is a dome shape positive wave for longer duration. Duration is about 0.27 second. Amplitude is about 0.15 to 0.55 millivolt. And finally, isoelectric period, U wave, it is final positive deflection. It is due to slow repolarization of papillary muscles. And thank you. This is all about lead system and normal ECG. Thank you all.